Hi, Daniel. So we're waiting 5 minutes and then we start.
By the cracks of his skin, I climbed to the top. I climbed the tree to see the world. When the guys came around to blow me down, held on as tightly as you held on to me, held on as tightly as you held on to me.
Wonderful. Hi, everyone. Welcome.
I am just going to spotlight myself to say hi. My name is Tita Kurtsakis, and I'm here to tell you the rules of engagement. So welcome if you're joining us. Well, we're all joining us on Zoom today. So please keep your microphone on mute. And if you have any questions at all before the interviews end or before our conversation ends, you can send them in the chat directly to me. I'm the only Tita here. And the session also has closed caption subtitles, and you can enable those on the bottom of your screen where it says live transcript. And I will pass this over to Roberta.
Thank you. Thank you so much. So before we start, I'm gonna do the land acknowledgement. So I would like to, so this series of events is happening across different institutions. So we have different acknowledgements, but I am combining both of them because they are valid to everybody, and also to those people who are joining us from other places. Think about your own land acknowledgement and where you are situated. And what kind of indigenous people were there before us settlers. So I would like to acknowledge the sacred land on which the University of Toronto, which is where I am right now, operates. It has been a site of human activity for 15,000 years. This land is the territory of the Huron-Wendat and Petun First Nations, the Seneca, and most recently the Mississauga of the Credit River. The territory was the subject of the Fish with One Spoon, One Broom Belt Covenant, which is an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and allied nations to peacefully share and care for the resources around the Great Lakes. And today, the meeting place of Toronto is still the home to many indigenous people from across the Turtle Island. And we are very grateful to have the opportunity to work in the community on this territory. So my name is Roberta Adriani. I am faculty at the, but I'm going to start from UT. So at UT, I'm a faculty at New College and at the Institute for the History of Philosophy and Science and Technology. And I'm also a faculty at the York University, which is the other institution that is associated with this. And I'm teaching in the bilingual program in communications at the Glendon campus. This is also an event that is supported by the Fields Institute for Research in Mathematical Sciences, where I am the artistic director of the Arts Sci Salon, which is a collective committed to fostering collaborations between the arts and technoscience. I'm passing the mic to Elena, who is my co-host.
Hello, everyone. I'm Elena Basile, and I teach also at the University of Toronto and in the sexual diversity program there, and I teach at York University in the Department of English in the School of Gender and Sexuality and Women's Studies and in the Master's program in Translation Studies. And myself and Roberta are the co-organizers of the speaker series, Who Cares? And its goal at large is to foster transdisciplinary conversations between doctors, researchers, writers, artists, both established that in training, who are also involved in discussing and working on the infrastructures of care, its biopolitics, and are working hard to address the urgent need to move towards more respectful, creative, and inclusive social practices of care, particularly in the wake of the systemic cracks that have been made obvious by the pandemic. Now, our roundtable today on data and triage culture is the third of this speaker series that will end in mid-April. If you missed the previous events, recordings can be found on the same YouTube channel on which we're now live streaming, and in the website for Outside Salon that will be soon spotted in the chat under the corresponding page for each event. This is the first roundtable of 3. There's the next one on March 18 and another one on March 25 that will keep adding layers of discussion and of understanding to this urgent question of rethinking care. We will have a second keynote conversation between Sima Yasmin and Bayo Akomolafe on April 1st, Friday, April 1st, and 2 live exhibitions by 2 artists, Alana Kibe and Camille Baker, and a performative final initiative by Caroline, I can't remember her last name now.
Signievich.
Thank you. Before we start, the other needed acknowledgement, we credited the land, now we need to credit the sponsors, the money. Not only the money, but also what is being given in terms of generous in-kind donations. A word of thanks to our funders and supporters. As Roberta mentioned, the series spans 3 institutions, York, UFT, and the Field Institutes for Research in Mathematical Sciences. And it is made possible thanks to the generous support of the Social Science and the Humanities Research Council, or SSHRC, of Canada, New College at the University of Toronto, and the Faculty of Liberal Arts and Professional Studies at York University. So lots of different contributions. And there's been major contributions by the Center for Feminist Research at York, the Sensorium Center for Digital Arts and Technology, also at York, and the Canadian Language Museum, also at York, the Department of English, and the School of Gender and Women's Studies at York University. At UFT, we've had the support of the DG Ivey Library and the Institute for the History of Philosophy and Philosophy of Science and Technology at UFT. Finally, I also wish to thank the support of our team, Tita Christakis, and today we also have Tom Worthington in the back, and an honorary team member is now Nancy Dragicevic. Just wanted to acknowledge you guys because you're doing so much work behind the scenes, so it's important. Okay, so I'll pass the spotlight back to Roberta now.
Thank you. Okay, so now that we've done all the homework, all the house stuff, let's start. So I wanted to start with a poem which appeared shortly after the first lockdown was announced. Actually, I was debating with Elena about when the lockdown started. As you all know, kind of the first big issue, like when we first realized that this thing was very serious, was a little bit when with China, but then after that with Italy, and when Italy went in lockdown. And this, it's debatable. It might be March the 9th, but some people say March the 11th. So if it's March 11th, today is the anniversary of this, which is actually very telling. So this is the point. I'm gonna say it in Italian, and then I'm gonna do the translation that Elena did, actually. March 9th, 2020. 9 marzo 2020. Questo ti voglio dire. Ci dovevamo fermare. Lo sapevamo, lo sentivamo tutti che era troppo furioso il nostro fare. Stare dentro le cose, tutti fuori di noi. Agitare ogni ora, farla fruttare. English. So the poem goes on and on and on, but this is the first few verses. This I want to say to you. We had to stop. We knew it. We all felt how furious, too furious was our making, our being into things, all outside of ourselves, shaking up each hour, bent on making it yield. So why am I saying this? This is a short paragraph, maybe naively or maybe hopefully, reiterates the now updated rhetoric of the "we are all in this together" that was kind of trumpeted in the first months of the pandemic. During the first wave, staying at home was a way to protect oneself and their beloved one in order to mitigate the coronavirus spread and to avoid putting a strain on the healthcare system. But the poem also calls for pausing, if only for a split second, the untenable speed of a pre-pandemic life, the crazy traveling, the unstoppable global system of trade, the constant growth, the endless transactions, and also their productivity. And we know today that this first lockdown really didn't produce the effect that many hoped for. It only caused temporary slowdown where only the most privileged could afford to shelter in place. So despite the praises and the clapping, frontline and healthcare workers did not see their working conditions improve at all. The call for care and caring for each other, the much needed reinvesting and strengthening of the depleted health system and better social services did not deliver as we hoped. Many people were thinking about it and they were actually saying it aloud, but this didn't happen. So the reality is that the pandemic did not initiate only any crisis, but exacerbated and made visible one that was already in progress. From the strain suffered by severely underfunded and understaffed hospitals to the taken for granted inequalities dominating the delivery of healthcare, the roots of this crisis are as cultural as they are economic and environmental. And among the underlying factors contributing to the current crisis is a dominant orientation towards healthcare that privileges a narrow focus on data-centered technological fixes and praises the potentials of technological delegation. So an unsustainable system and a ruthless economy based on the what academics call the necropolitical management of individuals and populations has culminated in the passive acceptance and even the cold justification of practices such as triage as an inevitable evil in a time of crisis and scarcity. So the current system forces individuals to compete in a bizarre struggle for the fittest, where the vulnerable actually reclaim their rights to the disadvantage of other equally vulnerable. So it's like the struggle of the poorest and the most disadvantaged, really. And in this, the institutional and technological apparatuses decide who is saved and who is left to perish according to certain criteria that really dangerously smack of new eugenics. So we see this in triage, of course, and we've seen it during the pandemic, and we see it in also hoarding the vaccines of Western countries. Actually, one of the person who was supposed to be here, and she's not, and I'll say it later on, she's from Mexico, and she thought, I cannot come here because with the vaccine mandates, I didn't really have the proper vaccine because those vaccines that are so coveted by people are not available to me. So we see all this, right? And we also see this situation in the abandonment of mental health patients, cancer patients who didn't receive any treatment, and generally the poor. So I'm aware that the pandemic also saw many gestures of solidarity, and in some cases, the emergence and the consolidation of new practices of care understood holistically and interdisciplinary rather than sectorially. So now for this roundtable, so this like big umbrella to say that for this roundtable, we invited a group of scholars, researchers, and creative thinkers to turn a critical eye on the systemic and epistemic failures that have brought us this very prolonged and now worsening crisis. So, but this, I wanted to say that these scholars, whom I will introduce shortly, also offer more creative or interdisciplinary and constructive ways to address and redress these failures. So this happens whether using math and data science, art and poetry, or whether applying holistic methodologies or combining and collaborating across different disciplines. So, so today we will have four guests. We were supposed to have five, but we are only four. So we have Sharmistha Mishra, we have Madhur Anand, Salvatore Iaconesi, and Oriana Persico. Unfortunately, Maria Antonia Gonzalez Valerio is not able to be here with us. She tried very hard to get a connection, but she's basically stranded in a place with no connection, and so we had to postpone her intervention. So she will be with us next week, on next Friday at next roundtable. So don't be sad if she's not here with us. So in the next hour or so, I will introduce each of the participants. And we'll ask them to introduce themselves in 5 minutes each. So each of them will introduce themselves in 5 minutes, where they will briefly address the topic of discussion and what they make of this roundtable, and this from their professional and theoretical perspectives. And then I will ask them some questions that we prepared for them from a really long list of questions. We only chose 3 because we don't really have time to do everything. And then we will turn to the audience and the Q&A. Again, if you need to ask questions, you can send them to Tita, and you can find her name in the chat, so you can send her a message directly. Okay. So we should start now. So I'm going to introduce first Sharmistha Mishra. She is an infectious disease epidemiologist. She's a mathematical modeler and a physician at the University of Toronto and St. Michael's Hospital. Her lab's work is centered around the causes and consequences of heterogeneity in onward transmission risks, with a focus on HIV and other sexually transmitted infections. Her lab's work on COVID-19 has focused on how social and structural inequalities and networks shape the emergence, spread, and concentration of infections and their health consequences, and how mechanistic and data-driven clarity around the local transmission dynamics could be harnessed for a more specific public health response. So she holds also a Tier 2 Canada Research Chair in Mathematical Modeling and Program Science. So thanks, I'll give the floor to Sharmistha. Thank you so much for joining us.
Thank you, Roberta. Thank you. So if I were to introduce myself, I feel as Roberta has already done that, I think I wanted to begin with why we entered the work around COVID from a modeling perspective. And that really came from work in the field of HIV, where we never approach HIV epidemics as a one size fits all. We're all in this together, in the absence of thinking about all the mechanisms that lead to observed inequality and therefore interpretation from a theory based around inequities. So the thinking about a health equity framework. And so what we know is, number one, from epidemic theory, from decades of work amongst shoulders or giants that on whose shoulders we stand, is that trickle down public health doesn't work. Yes, protecting the rich and those who have less exposure risk to an infectious pathogen has some small benefit to those who experience more risk or disproportionately more risk, but that trickle-down effect is very small. And that would be the definition of a shelter-in-place strategy that largely a subset of the population who is already at lower risk would be able to do, and that sort of leaves behind everybody else, essential workers in large part. And what I'd like to challenge us to think about, and what our lab has been working on, is to what extent that approach is essentially an excuse or a rationalization for not doing more from a systemic proximal perspective. To what extent could lockdowns have been a rationalization, an excuse not to think about or implement paid sick leave as a strategy, for example? And so this is where, in thinking about transdisciplinary practices and approaches, for us as a mathematical modeling lab, it's been really helpful to work with social epidemiologists, social scientists, in particular medical anthropologists, in thinking through this rationalization. The other part that I wanted to therefore bring up is when we think about, our lab has been thinking deeply about sort of what are we doing with our mathematical models? What exactly are we examining from a big picture perspective? And a colleague brought this up, a colleague on our team. Number one, did we essentially therefore design a racist public health response to COVID? And how much did we contribute as mathematical modeling as a field? Did we design, develop racist mathematical models? And they brought that up in large part because there's been an underlying philosophy of mathematical modeling that is agnostic, that it is what the data tell us, that it is the math and the logic without necessarily reflecting back on, actually, all of this comes from theory. It comes from a logic within which there are many heuristics and biases. And to what extent does our training and our lived experience bring to that table? So it really is about sort of the biases in our decision making, our justification of what we have decided to answer in our mathematical models. And the last thing I wanted to therefore bring up is what's happening now is there's a lot of talk about equity. A lot of talk about equity in the field and disciplines, and folks, especially when you think about Twitter, of folks who've never perhaps worked on equity before or lived through what health inequity and inequality means. And so there's this great paper by L.A. Lett that talks about equity tourism and the extent to which this narrative around equity, and that, well, shelter in place actually leads to more equity, or this other strategy leads to more equity, without necessarily framing it in his decades of work on health equity frameworks, and disentangling that or ignoring the social justice aspect about health equity. So I wanted to leave it on those comments and discussion points, which I'm looking forward to talking about with all of you.
Thank you so much. I took a lot of notes. I'm already thinking, like my brain is already tingling. So, but I'm gonna hold on to it, and I'm gonna pass the mic to Madhur. Madhur Anand is the author of the book of poems, A New Index for Predicting Catastrophes, which is, by the way, the book that where I got to know her. And the experimental, and please read it, it's fantastic. And the experimental memoir, This Red Line Goes Straight to Your Heart, which was published in 2020, actually. Both considered trailblazing, I agree, in their synthesis of art and science. A New Index was a finalist for the Trillium Book Award for Poetry. This Red Line won the 2020 Governor General's Literary Award for nonfiction. The second collection of poems is Parasitic Oscillation, which has just come out. It's coming out next week. something like that. I just order it, so like I pre-order it. Madhur is also a professor of ecology and sustainability at the University of Guelph and was appointed the inaugural director of the Guelph Institute for Environmental Research. So thanks, Madhur.
Thanks. Thanks, everybody. Nice to see you all. Thanks, Roberta. I think I will just start by saying that 2 years ago, when the lockdowns were ordered, that very week, I got an email from one of a graduate student I was co-supervising, and it was like this, and he, it was just sort of asking a question about the model that he was working on, the ecological model that he was working on, and it had the word quarantine in it. And it suddenly just felt incredibly surreal to be talking about that and lockdown at the same time. He was working on a model of invasive species and how we could design strategies to stop the spread of invasive species in ecology. It was an invasive pest in forests that spread through firewood movement. And one of the possible strategies was to block off these natural areas like provincial parks and things like that, which was kind of like quarantine, right? You quarantine the natural parks so nobody can go to them, so nobody is spreading it under conditions where infestations were high. And suddenly I realized, and I mean, there have been lots and lots of analogies made already, standing on the shoulders of giants, between human disease spread and the spread of other things like invasive species that you're trying to control, or pests. But I actually turned with my collaborator and the student. We just sort of, the very next meeting that we had, I said, can you just stop working on forest pests? And, I think everything that you're doing for this model could be applied to COVID-19. And but it was in the early days. It's almost hard to imagine the context of that now, because it was obviously before we had the vaccine, right? To me, that's just like a huge before and after. And so it was really a question of, how effective are these lockdowns going to be? How much do we have to do them? How often? How, where do we have to do them? To what extent is it related to the level of infestation? And so many different things. And these were all in the model. So that's what we did. And that's what he did. And he then published, we published together a paper on that. And then we went on to do several other direct interventions. Like, I felt that I had turned my attention as a scientist from ecology to health through modeling. So that's already a little bit of a prelude to the interdisciplinary conversation that we're going to have later. However, I was primarily introduced here as a poet, and I'd like to start by reading you a poem, short one, from my first book of poems, that is a found poem. So this is one of the several ways in which I look at my science a little differently, and I look for many things. So you'll hopefully see that. What I mean by a found poem is that all of the words in this poem occur in the scientific article. This is my own scientific article, but obviously not in the order that they will appear in this poem. So I scan the scientific article, I look for words that speak to me at that moment, and then I make a poem out of those words, out of that list of words. So it's called The Strategy of the Majority. Is falling back. Pre-existing tendencies cooperation from the public, a vector for the spread of catastrophic programs. Purchasing strength, payoff, or penalty, the rich are unfinished. Do not bring education campaigns, economic incentives, or ordinary differential equations with fixed carrying capacity to the final destination. The strategy of the majority is falling, reducing adherence to control measures. The price of finding equilibria is increasing. And that was from an earlier paper. This is all done pre-pandemic, an earlier paper that I co-authored with a few other authors entitled Modeling Interactions Between Forest Pest Invasions and Human Decisions Regarding Firewood Transport Restrictions.
Thank you. Thank you so much. That's very inspiring. So the next speakers are Salvatore Iaconesi and Oriana Persico. If you want to see their longer presentation, you can go and check out our YouTube channel. They did a fantastic talk yesterday. So Salvatore and Oriana are artists, researchers, teachers, and cultural activists. They work and live together since they've been working and living together since 2006, and they are authors of global artworks and performances united by the exploration of contemporary technological humanity and its continuous mutation. They are founders of Art is Open Source and Her, She Loves Data. And now they are developing their new project called the Nuovo Abitare, the new living, the new dwelling. The network, so this Nuovo Abitare is also the network and research center that they use to study the psychological implications of data and computation. And they started actually during the pandemic, as they told us yesterday, in 2020. So they also have started this new archive of the rituals of Nuovo Abitare, which is called Arna, which represents the evolution of the research. So Salvatore and Oriana.
Hello, everyone. So nice to be here. Talking about complexity, we are in Italy and it is about 11 even so basically it is our night with you today. We are so happy to close this
full day
and this actual anniversary of the pandemic, which in Italy was the 9th. So just to let you know. And we were like when all of it started, we were in what we can call the perfect storm, because while the pandemics was rising, we were in a hospital actually. And so we were able to go out to skip the hospital just on the 8th of March 2020 after a surgery, and so when we went home, we found ourselves in this new world, like this lockdown world. And we have seen all of it from a very strange perspective, because living in a hospital and seeing all these things that were changing, you live also in a bubble, and then you go back home, and then you start thinking about your life. And it was a peculiar moment also because we were facing cancer and a huge surgery. We were, alive, and we were happy to be alive. And then everything started to pop up in our mind. So lots of connections started.
Just to be clear, when the lockdown started, I just was out of surgery, and what was happening was that the hospital was shutting down. So while the pandemics and the lockdowns were starting, we were completely invaded. People with their suitcases were leaving the hospital. Surgeries were stopped. People were being sent back home. No? And it was crazy. The pandemics was hitting full strength also in the realm of information and data. People were massively exposed to war bulletins about the pandemics.
Real one.
Completely and carelessly fed data about people that were diseased, sick, dying, with no absolutely care for their fragilities.
Psychology.
No? So the use of data and information at the time was truly violent and careless. So in this, and even we were forced to go back home, no, because the entire hospital was being transformed into a COVID hospital. So the world in which we found ourselves kicked out a cancer patient, as I was, and his wife, no, Oriana, and our families out of the hospital.
And we were happy just that the surgery, we were able to make it happen because it was on the 4th, on the 3rd or the 4th
Absolutely.
of March. So it went but just 5 days ago.
But that was the reality, no? A couple of days after the brain surgery, we were practically kicked out of the hospital, no? And so this is, the information, the data, these war bulletins, and these awful characters popping out of the TVs, screaming at us, stay home, no? They were morbid characters dressed up as clowns, saying exactly this: we're in this together, no? Let's all stay home.
And screaming, because I remember very well they were screaming that. Not we are all in this together. Stay home. Don't be stupid.
It was a very violent experience, and so since we operate through technologies, we study the relationship between technology and psychology. We decided that we should do something about it. And that's when we started developing these new rituals where
Of the new
where data and information and computation are not forces that divide people, that keep them apart, but unite people and bring them together. No, and that I wanted to clear, because that's the origin of what we are now calling nuovo abitare. It's a thing which was born from the suffering in the flesh, okay? And that is very important because it's an origin.
Yeah, I believe we can then discuss it and go through details and also through this experiment we did, if you like it. But most of all, have a conversation about something that all of us, I believe, felt and lived and went through during those 2 years.
Yeah, thank you. And I think that this somehow also contextualizes a little bit what you said yesterday during your talk, like the whole series of experiments that you've been doing also with our students. But during the last week, we had a sort of experiment that went a little bit unpredictably. But yeah, this really contextualizes things, and I really wanted you to tell me about like some of your personal experience and that kind of personal experience that brought you to this type of activity. And I think this brings it back a little bit to all of the other interventions and how from the work on environmental issues, Madhur was able to extrapolate and to make a comparisons, and how Sharmistha is what she's been doing for a long time with people who are suffering from HIV. So we had some, so this is all prepared, it's all planned. So I think that we should move to the first questions. So among all the questions that we had, and there's like a really long list, and they keep coming actually, and there will be more. So we selected 3 questions, and I would like to start with the first one, which is basically the obvious one. This is for all the roundtable members. So what transdisciplinary practices can help ameliorate the atomizing pitfalls of turning the patient into data? So you see the patient being turned into data, but also the protagonist of modeling that are turned into data, and like we heard that modeling is racist, but we also have the protagonists who can be compared to multi-species. So like what are transdisciplinary practices that can help ameliorate this turning the patient into, or the patient of something else, into data? Who wants to go first? Silence, moment of silence. I don't know.
No, ladies.
Should I call someone? Okay, I'll call someone. I'll go. I don't know. Let's go in order with what we started. So, Sharmistha, yeah.
I think the first thing that I would think about. So a lot of transdisciplinary science that I've had an opportunity to be a part of was somewhat organic with respect to sort of the spaces and the opportunities for conversation. But I often reflect back on thinking about it from a clinical perspective around cultural safety training and embedding cultural safety into our clinical practices. And a key tenet of that is clinical humility. And so thinking about how we apply that as a practice, as scholars, as scientists, in terms of sort of scientific humility. And I don't know if that necessarily comes from training, from combination of role modeling, or just systemic changes in how we actually provide graduate training and supervision and mentorship. But that aspect of, well, as an epidemiologist, this is what you need to do is, I appreciate the words that were provided around the violence of data, and thinking through about the violence of our words as well in pausing interdisciplinary, transdisciplinary conversation when the power in the room is the epidemiologist or the public health expert from a particular perspective. Yeah, so I think that those would be some of my thoughts.
Yeah, I think it's actually very interesting that you're mentioning the power of the epidemiologists. Is the power of the epidemiologists also the power of the authorities? Is the power of the priorities that are set to determine who's worth the cure, or who's worth being studied, right? So, Madhur, would you like to?
Yeah, I think my experience mostly with transdisciplinary work is at the interface of art and science. And so, clearly, like, spaces and conversations like this are really important to have, just like more mutual understanding. I think, I think we all agree that there's a lot of disparity between many things, including, the world of the arts and the worlds of the sciences, and between the people who are practicing it, but also between how it is felt and communicated to and perceived by people, by citizens. It's very different. So there's a big dichotomy, false dichotomy there that I feel it's really, really important to bridge. And how to do it, mutual understanding. I think there are some pathways into it. And, part of it is that on the scientific side, we scientists are not usually actually involved that much with communicating science. I mean, it's changing, but traditionally we don't do it. And it's led to a lot of problems, but it's also sort of like ingrained in the practice of and definition of being a scientist. You do the work, you publish it, and then you do some more work. And then it's taken up by media and many other places. And now, and that cannot always be positive in its impact. And then the other thing is that the way we communicate science to each other, scientists, that is through language and information that is, I don't know, not very human. Like, we're not encouraged to use the first person when we write. Our articles are very formulaic and so on. And so, yeah, we're just constantly, reminded of how that's not part of science. So, I mean, yeah, more conversations, more interventions between the two, more investigation into the pathways through which discovery occurs in science, rather than focusing on the products of science, which is what we're always so obsessed about. Even in media, right? When we have conversations with journalists, they want to know the finding, and hardly anybody asks you, what made you interested in this? How did you do this work? And how do you feel about it? Like, just whatever other things that I think, we're not really used to talking like that, but I really do think there's it would be like an entry point. It's not like the solution, but it's an entry point into the conversation.
Yeah, and I'm just hearing that Elena wants to say something. Like I should invite her over, but before that, I told her, hold on a second because I have something like you, Madhur. You just said a couple of things that really lit a light bulb, and so when you're talking about lack of communication, I'm actually immediately reminded of the violence of data that Salvatore was mentioning about, but also the fact that so basically we are bombarded by all these data, and first of all, they are. Basically, we are left to our own devices, and this is why there was a lot of misinformation going on, because there were all these armchair epidemiologists who were all data scientists, weren't really knowing what they were doing, and they just went on and they just totally relied on data. And a lot of these data, especially at the beginning of the pandemic, were not really particularly reliable either, because they were based on something that had happened before. But besides that, another thing that I'm reminded of when Madhur is speaking is an article by Chauvin Roberts, who is talking about the fact that sometimes scientists are somehow like, they know that models do not work perfectly, and they are afraid to admit that, because there's an assumption that data are like discrete and they don't lie, right? And so like she's talking about this term that I really love, epistemic uncertainty, and I think that this is something that we are facing as human beings, but we are also facing when it comes to, like, if you're a scientist and you're faced with having to communicate something that you know is not perfect. So I don't know, I would like to give a chance to Salvatore and Oriana to respond to this. And also I would like to bring in Elena, who will have some follow-up questions, I think, or comments.
Who starts?
You, this is yours.
Once we did an artwork which was actually I'd call it a new literary genre because the artwork was a new type of autobiography, an autobiography through data. And we did the first book of this new genre, which was called Ghostwriter. It figures. And that was a really interesting experience for us because data completely transformed to us, to our sensation and to our feelings. Because data transformed into literature becomes something else and starts living in culture. And that's an enormous transformation because you can perform data, it can self-represent through data, and data also becomes a common ground in which different agents, entities, human beings, non-human entities can meet, because humans generate data, but also trees and forests and buildings and animals generate data.
And viruses.
Absolutely. So, absolutely. So we can imagine to read the autobiography of a forest, just as we can imagine reading the autobiography of a human being or whatnot. That is our suggestion, no? generative data instead of extractive data. One, be them human or not, can use to self-represent. What happens when the agent that wants to self-represent and want, maybe is not the right verb for it, is not human. The focus then falls on the concept of relation, no? And translation, because that's where there is the opportunity for expression. For example, in our practice, we are constantly inventing new social roles with the objective of developing and enhancing the sensibility which is needed to establish relationship also with non-human actors in our environment, so that data becomes something which is generated with care, no, with an approach of caring, to enable this mediated self-representation. For example, in a work which we did in Palermo, which we spoke about also yesterday evening, a river's health was mediated through this new social role of the custodians of the water, which lived this new data ritual of instead of going to the river to wash clothes or to get water, they went to the river to get data, no, about the river's health, no, and no.
Yeah, and I wanted to add another methodological thing that we systematically do with this data, is that we reposition this data in society. In Italy, we have a wonderful psychiatrist, which is Basaglia, and he did really a revolution when he about come si dice manicomio?
Asylums.
In asylum, in a mental asylum. Questioning the fact who was in and who was out. So, and so where data are is a big issue. So because as soon as we are able to reposition data in society, as Basaglia did with mental illness, we are doing an experiment of social imagination, new possible social imagination. So data is this place where we can play, when we can exercise our possibility to reinvent perhaps a dignified version, because we can, do things from scratch, okay, of what we do in our life. And talking about patient, we did many things on our skin. I won't go through these, but for example, it is a very similar example to the one with the river. The river is very extreme because it is a non-human entity, and we really need also in this data can help us in living to our back this idea of that we are a central thing in the universe. This is not true. So we are surrounded by so many entities we can relate with, and now we have this possibility also thanks to data and artificial intelligence. Instead of just calculating, we can use this computational agents and data to relate, not to expand our possibility to relate in our environment. Okay, so this is something that we really can do, and this is something that is very central in what we call this new living. Okay, and so for example, once we went in a research center, is a European hub for big data on epilepsy. Okay, and so we started to search the ways to visualize epilepsy, and it was beautiful. So after that, we created a performance which was the body quake. So this idea of body quake, earthquake of the body, the seizure, okay, of the epilepsy. But this was about transforming the isolation of epilepsy and through data, because the performance was about a woman, in this case a woman, a performer who was wearing the data on her body through body mapping of a seizure. And so it has become something that someone else can have on a body, something that we can share. And also, for example, a technology, a wearable technology enabled the audience to feel the same seizure, but through a tactile wave. So it was a glow that someone in the audience can wear to feel this epilepsy. So, but this is about changing the position, working on data to change the position of what we can do with this.
Sensibility.
The sensibility, exactly. So, for example, also you, if you have epilepsy, you are not there and you never see epilepsy. But through the performance, you can see. You have another role, okay? And also, illness is not just separated in hospital; it is in the middle of society. So I believe this is something, a big space for discussion in this.
I wanted to. There's so much to say, and so many different. So much has come to my mind while you were all four of you were speaking. I wanted to maybe kind of put some threads together of everything that you've said so far that stuck with me, and that returns sort of to Roberta's early questions around the ways in which we think of data, and the way both Sharmistha and then Madhur and Salvatore and Oriana are all kind of encouraging us to think about data differently, or to think how entangled data, how situated data are, and then the kind of the responsibilities that each one of us in different ways and different social roles that we occupy, both as experts or as the target of data, or as the ones from which data are extracted, or the ones that are generated data, then occupies like a very complex ecology. And a couple of things really stuck with me. Sharmistha, it's the first time I hear it, but I really love it how you spoke about trickle-down health. It's actually, we have this sense that in the trickle-down health model is just the United States, but that's not true at all. It's actually very visible everywhere. And one thing that came out from the very first keynote or conversation that we had with a writer and clinician scholar, Bahar Oran, on I think February 28, was about sort of the emergence and the naming of our health system as modeled around a carceral model. It breeds isolation, it breeds violence, it breeds carcerality. And it seems to be sort of both exactly what Salvatore and Oriana's experience of the sort of the COVID hospital kind of suddenly brought up sprung up into kind of emergency being, but also exactly sort of what you are saying, you said at the beginning in your introduction, Sharmistha, around indeed how the modeling of public health data then as giving the shoulder to lazy, at the end of the day, lazy policies that just go with what it's easy to just implement, but de facto implement with an imaginary idea of the normative citizen, and in fact being the middle class white collar citizen, is really something very important that that you highlighted. And I think this kind of also goes with another crucial keyword that Madhur used in her poem, The Strategy of the Majority, which is not majority at all, but it passes as majority. One question, and this kind of goes back, will connect to something that all of you in different ways are doing, but I'm seeing particularly sort of both Madhur and Salvatore and Oriana kind of just enacted by way of describing, by way of reading the poem, and by describing their artistic experiment. What seems to be needed are very much different, and this is, I am quoting Salvatore here, a different imaginaries of the situatedness of data, of the foundational kind of relational aspect that they have. But in fact, in terms of public messaging that we continue to reproduce, and that the media reproduces, journalists reproduce, etc., it continues to be this idea of that what's objective is non-relational, like what's objective is there and it can be manipulated at large, and it's not, does not in fact, and we are always committed to invisibilize. Science is committed to invisibilize that the biases, the work, in fact, these specific perspective, because of the commitment to numbers are always assumed to be universal, right? So I don't know, I'm going on and on here, but I'm just wondering if any one of you wants to speak to this a little bit more, to really the problem of what's the imaginary of data that really needs to kind of be praised apart, like.
Well, I'll just say something to that, Elena, because I think it is a problem of language, partly, maybe largely, maybe entirely, I don't know. But that's where I go to poetry. And because, you know, I know that there are many ways to describe my science in many, you know, in colloquial terms, in conversational terms, but I think it still misses that imaginary realm, that realm of, I don't know, maybe that's kind of why I am going to poetry. You know, from some of my own scientific articles, and now in my new book that is just coming out, I look for poems in like papers from Einstein, from papers from like fundamental scientists from like the 19th century who made like these fundamental discoveries that are now being frankly, like they're applied to so many things. And if you look actually at a lot of our ecological models, including epidemiological models, the mathematics of it is often quite simple and can be traced back to these models that were developed in like 1920. And so one example is, you know, if you want to model oscillations, self-sustained oscillations, they're called. The simplest way to do it is through these set of models called the van der Pol equations. And they're really quite simple, but they've been used to model things as broadly as like neurology, sociology, economics, the human heart. So on the one hand, they're simple, but on the other hand, they can be quite universal. They can be the language, but obviously only for mathematicians and modelers. And then the question is, what is the language for others? And maybe poetry is not the language for everybody. You know, I know that it's a little different, but I think what it can do is allow for that intervention. I just call it an intervention towards developing the imaginary. So I'd like to read you another poem quickly. And it is
a sucker for poetry.
Pardon me, you're a sucker for poetry. And it is another found poem from van der Pol, 1926, a paper called On Relaxation Oscillations, published in the London, Edinburgh, and Dublin Philosophical Magazine and Journal of Science. Damped oscillation. If it happens that the resistance gradually communicated by the author is a sign, if it happens that it is a solution because it indicates actual physical systems, if a sudden jump becomes equal to approximately itself, if unity is practically reached after one revolution, if keeping track of a point means a series of short lines, if we write without dropping the accents, if normal is dealing with further buildup, if the dead have been neglected, if circulation, if time, if relaxed, if satisfied, flywheel is equal to telephone is equal to heartbeats, however small this substitution may be.
Beautiful, beautiful.
That is very inspiring.
Yes. I don't know if either Sharmistha or Salvatore and Oriana want to add anything. It's difficult to follow, but
if I may,
yes.
just to try to ease this, because so I'm thinking about and this is also the type of question that I had afterwards. So we're not really going very far from the tree, but so I think this can be also connected with like so if the question is also a question of translation and a question of understanding or misunderstanding or reimagining, as Salvatore and Oriana say, then do we need an in-between? And in the case of Madhur, maybe like this in-between can be poetry, or do we need art in between, or how do we open up the silos? How do we allow the circulation of discourse, and we engage in a real dialogue? And it's not necessarily art. I think there's also like I think it is really a question of translation, but like I think that it's the trigger that we are missing. Like, how do we establish the dialogue, right? Like, I was also thinking about, like, we had a lot of discussion with Elena and what else, and I don't want to keep too much space, but like one of the things that we were thinking about was like how, like, the dialogue between for example, patient and the scientist, or patient and the clinician, and how sometimes there's this perception that the clinician is cold, or sometimes there's the perception that the patient is not being told everything, or the patient is kind of infantilized in some way. And I'm not sure that it's all because the clinician wants to infantilize the patient, or it's not because the clinician wants to just communicate data and that's it, or wants to talk jargon. There's something that doesn't really fit. There's something that doesn't allow communication in many instances. Of course, there's also those who think only by data, and those who like infantilize patients, of course. But like in many cases, it's not like that, right? And there's something that impedes communication, and I'm wondering if this is also part of that issue with translation and like talking by silos or whatever. So like, I don't know if this helps with the like reaction and the response.
If I may,
Yeah, sure.
There is also another part of this, because when we speak about data, we imagine something and I don't mean we others might imagine something which is not, because data has always a theory behind it, no? Data is one of the most ideological things that I know of, no? Because to collect data, you have to have an ideology of what is important to be collected, no? Thus, it turns out that data is an ideological entity. If you have to measure the room, the noise in this room, you have to have an ideology of how to measure noise, what microphones to use, how to place them around the space. And so this is the thing that is worthwhile remembering. Because there is a proto-political discourse that has to be brought up before politics, and that is a discourse of sensibility. What happens when data is not used for politics, but it's used before politics to enhance sensibility to phenomena? that is a discourse which comes before politics. That is a discourse which help us take the hand of the flame. Okay.
Not to burn.
Okay. That is a discourse which helps us all, no matter what the ideology, to take the hand of the flame, and then we can discuss. Okay. That is a thing that we should and could remember when we do our practices, and that is a thing that is truly important for us. For example,
Yeah, I just want to say I'm here. I think that is what art does largely, and so maybe it is why you don't have to. We don't have to always just reduce it, but I feel that's what I do when I am observing and noting data as a poet versus when I do it as a scientist. And it's funny because sometimes I really feel like that. I feel like as a poet, I'm collecting data. I observe, sometimes I even do, but it's, it seems nonsensical from a scientific perspective. Like one day I just sat on my porch for hours, noting the minute movements of a robin in her nest. And I knew that it was not, I didn't have any hypothesis. I didn't have a purpose, right? But, and that was the poet's work. That was the poet's work. So I don't know how else to describe that work. That's the artist's work. Perhaps, yeah.
I would love to remember one thing. So in Greek, aesthetics means exactly being able to perceive. Aistanomai in Greek, it's about, so for Greek people, we need to sense, okay? So sensibility, we have a very non-romantic idea of sensibility, which there is this beautiful word which an English neologism which we really like, which is sensible, able to sense. Okay, so especially about this, really able to sense. So
that's perfect. Yeah, that's beautiful because
I love it.
Yeah. This nonsense, which is another word that I use, it totally cancels that.
Exactly, because to sense is not just meaning, but is also about being able to make a relation between us and what is non-us, the environment, the something which is, something we don't know and we perceive. We know the world because of perception. Okay, perception is an aesthetical problem. Sensibility or sense ability is an aesthetical problem. So in this sense, art reveals us another way to know the world. So another way of knowing. we are really talking about this. I don't know, I believe you wanted to say something. Yeah.
Before I
you brought the quantics.
I have a book for this. David Bohm, the implicate order, no? And he has this beautiful expression of a parallel between arts and science toward the end of the book, which says this exact thing, that it helps to discover different orders, no? And which is very important.
I just want to interrupt briefly and say, Madhur, it's almost 6:30, so I just wanted to say that.
Unfortunately, I have to leave just at 6:30, so I'll just sort of stay on and listen to the next person, and then I have to leave. But it was such an interesting discussion, and it was so great to meet you all.
That was fantastic. But I also want to hear from Sharmistha, because I feel like you were talking about art, but I think that like she was taking notes. So like I don't know what she thinks about all this.
So I want to say, I wish I was an artist. I wish I had the words. And thinking about, I love that poem, Madhur. And I was thinking about when, Elena, you were describing data and sort of this, the objectivity of it. We use this, we say data don't lie, but but we're then kind of ascribing this ultimate truth. And so I guess the question is sort of, what is truth? And really what we're doing is we're interpreting, and I guess as scientists, and I would also say almost as clinicians, you know, Oriana, you mentioned sort of, we need to sense, and I feel like what we're doing is we need to solve. So we're sort of reacting, but perhaps prior to or without allowing for that sort of perception. And so that need to solve, that the time to take to actually interpret. And I feel like almost what's happened is that the part of science that we do, so the scientific method, which asks us to test hypotheses, asks us to generate them, and to think about whether our models are falsifiable or not. And a lot of times, without the pause, we're actually a lot of projection work with our models. They're not falsifiable. So we're sort of perceiving and projecting without necessarily testing hypotheses either. So this need to solve in the context of a pandemic, I wonder if it hampers us, and the dangers that are the consequence of that. I wish I had, the art and words to
Actually
articulate.
Yeah, may I say something here? Because we are dealing, I think, with a very real and at the same time very hampering problems. As much as we can exalt art in this particular at this particular conjuncture, we are faced, I think, culturally in the West with a history of bifurcation of the arts and the sciences, and of a submission of the science to instrumental rationality, and leaving sort of a kind of almost a division of a cultural division of labor between the arts and the sciences. And you also get a problem with arts, because then arts can do all this amazing stuff and then go into museums and not have that necessary, strong, needed, pervasive internal impact into artists. And you can see, like, both Oriana and Salvatore actually act as researchers. They're doing sort of a creative research that is re-articulating, and they call their work experiments. So the one thing that just struck me, Sharmistha, about what you were just saying is indeed sort of how beholden sort of we are, and we have been through the pandemic. And even it's not just a question of the trickle down public health, which is enormous, but how beholden we are to an imaginary of instrumental science. Sort of that science that has to have an instrumental within an imaginary, again, an imaginary of transaction, an imaginary that needs to be, immediately available, immediately there, and especially when it comes to medical research. I'm teaching now a course on cancer narrative and cancer. The ways in which those entanglements of science, technology, research, how frequently and how regularly research is then again submitted to all kinds of distortion linked to economic rationality, to having to publish your paper as quickly as possible, and where patients become guinea pigs for something else than their own health, is just mind-boggling. And one thing that came out also of the conversation with Bahar Orang was also just the need, and Bahar Orang is someone who indeed seems to be kind of trying really hard to engage in from the inside, from within the hospital setting, to sort of to open up. But one thing that she said, now I'm having a moment of I had it in my head just 2 seconds ago, and it's now disappeared. Oh yes, how like the hospital seems to be also in the grip, the hospital as an institution, in the grip of the lack of imagination, of there's just like there is no time, there is no time to think outside the box, because the box is all you know, and it's just terrible. And I think it is a disservice at the same time, both to science and to the arts at once, that this is happening. And I'm not sure exactly what the solution is to it, but I do see, I would argue that even the kind of the thoughtfulness of your own work, which is about thinking of the process for which our data is a model. A model is not just a model, it's modeling, right? It's a process. Has its own aesthetic aspect, if you want, aesthetic in the sense that Oriana was just mentioning, of the sense able, so enabling a sense other.
I think that's I think you powerfully articulated the confines and the rigidity within which vertical spheres of sort of this even the word discipline, has its own sort of embedded meaning when thinking about sort of disciplines and I think of sort of the extent to which the powers, without the institution, without the concrete walls that sort of confine that, how to sort of seep out all of that, knowledge, really. And so I think we think of data as this agnostic, which it's not. We think of interpretation as agnostic and objective, which it's not. But also sort of what is the value of knowledge, other forms of knowledge? And certainly, it's interesting sort of thinking about quantitative folks who work with data saying, well, those are anecdotes, except when it's my anecdote. And it's except that it was my anecdote that drove me to this research, question. It was my anecdote is my experience, but your anecdote isn't just an anecdote. And sort of it's that, but to what extent sort of that the hospital walls are institutional walls, are reward structures, the way grants, we apply for grants and we compete with one another. To what extent sort of that we're sort of pushing against this thing that's not very elastic and challenges us.
Yeah, no, it's mind-boggling that way. And I think like the COVID has made clear just how rigid it is, but also how exclusionary at the end. How damaging and violent it is to both those of us who are left out, but those of us who are also working from within those structures are, contorting ourselves to fit into them in ways that eventually are damaging to us, and it's yeah.
Can I add something about what was very clear, and it is more and more clear in my mind and our mind, is about what you were saying earlier, and also this box, which is the hospital or other, or being, the research center or whatever we are, wherever we are, is the realism. we are blocked in, and it is it is really about imagination. So the world, it is what it is. So the hospital is what it is. Data is what it is. Artificial intelligence are neural network that have to be fed with enormous quantity of data in a very, very small time. No, so anything we look at, we see this domination of the realism, and it is something that another person, he died for that. Perhaps it is a philosopher, a writer, a thinker, Mark Fisher is not my favorite, actually. I can have many remarks on that, but it touched a point, in my opinion, when he was talking about capitalistic realism. I would never use this word, but realism, yes. I don't know if you wanted to say something.
You say yes. Yeah, in terms of that, so we are talking about boxes, we are talking about imagination. I guess implicit in it is what Sharmistha, you said. You defined very beautifully the fact that we the approach that you described is an excuse to think there's an excuse to not make any change. And like you brought as an example, like for example the implementation of sick leave. So I'm really struck by the fact that there is always yes, there is. So we are portraying this as if okay, so we have boxes, we have structures in place, and we feel kind of very boxed in this, but there's also some intentionality to it, and you actually said it very, very clearly with the fact that like by saying that the data are racist. So so I don't know. I think we should spend a little bit more like a little bit more on that, because I think that is very important. Because there's like, I feel like there's something that is intentional and something that is not intentional. But what is intentional is so implicit that we don't even perceive it as such anymore. It becomes like so normalized, right? So,
and I think that speaks to thinking about sort of who cares, but really sort of, we mentioned power, sort of who is at the table, who is making decisions, who is in the public realm, sort of the Twitter influencers for public health and so forth. And reflecting back on, most of us have had success within a system, and as a white adjacent person with the privileges that come from succeeding within institutional white supremacy, I've succeeded within that. And so to what extent is I can call out that we don't have paid sick leave, but I still, in the end, benefit from passive interventions and not active interventions, because ultimately they don't affect my life right now, irrespective of lived experience in the past. And so I think that's uncomfortable for many of us. It's an uncomfortable space. It's a challenging space. And I think my experience with public health in the last 2 years and at different tables has been that we need to solve quickly, rapidly, sort of stamps out, and the further discussion and the further, well, actually, we're giving in each time. Yes, we should do all these things, but we haven't. Therefore, we need to do this. But we, and that was sort of the recurrent narrative with every wave. And I remember just before, it was November or December, where a very bright colleague called out and said, well, it's not the cases we're seeing now, the epidemic we're seeing now with wave 4, with wave 5, it's not about social inequity, social inequalities, and social and economic marginalization. It's about vaccines. And neglecting the complex causal the pathways that don't put these two as two mutually exclusive. And the data are very clear now, depending on how, again, one interprets them, but the concentration of how COVID deaths have concentrated in Ontario by economic, sort of the economic margins have not changed between any of our 5 waves. And this is despite interventions in place and other factors. So, but I remember thinking it felt comfortable to say that it wasn't social and economic marginalization anymore. It was vaccine. It was easier. But so all to say, but that's always in the context of people with those of us with the privilege of where we've been able to achieve where we are now.
Yeah, and the same also happened with various lockdowns. Why are people not staying home? Like these kind of questions, right? And why are people like as if like people who could not live in smaller housing, they were at fault for something. So there's so many complexities to think of that have not been considered. So I don't know if there's any question at all from the audience. I feel like we've kind of like mesmerized them with we are chatting. So I guess we can just give a few final remarks and then call the night, because the discussion was already very very rich. Elena, you want to say something?
As per usual, I do want to say something because what Sharmistha just said about what was happening at the table, sort of on the side of the experts, and this constant putting aside other considerations because of an emergency. And so the emergency always, this is potentially like a good, I'm just now plugging in for the next roundtable, which is on critical care versus sustainable care. But it's also, so it's part also of another tyranny. We've got the tyranny of the carceral institution and the tyranny of just-in-time interventions, the tyranny of this in other places I've called also emergency temporalities, which also dogs, I think, activist circles. That you only intervene when a crisis is unfolding without seeing that in fact the crisis is in the everyday. When an official crisis is unfolding and the crisis is in the everyday. So one thing that strikes me about what you were just saying is that, and I think here it's also kind of those relative discourses that we also engage in, and as all of us in different ways are part of the experts, whether we want it or not. I'm in the role of the social role of experts. I'm not necessarily an expert in public health, but I'm a teacher. I'm sort of I play a particular kind of role. the question, it happens when we are in these situations that then we are singled out amongst the experts as the activists. Right? Oh, but you're doing, you're doing stuff that, and then, but I think it really needs to be articulated and opened up and put front and center on the table. No, this is the emergency, because if you don't look at it, if you don't look at this, everything else continues to in fact tell the same old story, a familiar narrative that has become a broken record, and that and now I fear it's actually repeating with Ukraine and with the geopolitics now. It's feeding both on the Russian side and I think on the Ukrainian side, nationalist, sexist, patriarchal narratives and white narratives that are just not again teased apart enough. And there's always this thing when something is identified as a crisis, you call everything towards known narratives, but the crisis is there to show you that in fact those narratives don't work anymore. And I think that's really something that we need to think very carefully through.
Elena, that was my suggestion, because there is a parallel which is very precise among complexity and tragedy, because complexity by definition is that which has no solution. No, complexity is complex and has no solution, because engineering might and design might subdivide these enormous interconnected and interdependent problems, no, into smaller ones. And they may even achieve to diminish the impact of these problems, no? But when you divide these problems, you're not confronting with complexity, no? And thus, complexity is actually a tragedy, because it has no solution, at least not in an engineering sense. But tragedy maybe may have a way of confronting with it. I don't know the word in English.
Say it in Italian. Jesus, I forgot. Non me lo ricordo.
Agnizione. In Italian, it's the way to in which tragedy is confronted with is called agnizione, ignition. I don't know if it's a word in English.
I think you're talking about the Aristotelian anagnoisis, il riconoscimento.
Exactly.
Sì, esatto.
No.
So
and
it's
ignition.
It's the moment in tragedy before catharsis, like the moment when you.
And it's a change of state.
Yes, it is.
And it's a change of state. It's a changing condition. And we usually it's suggested by the choir. Because
the choir.
Choir.
In tragedy.
Because tragedies have the choir. Okay. agnizione, ignition, I don't know if
Oh,
such a word
Anachronesis.
exists. Eh?
Oh, it's a very difficult Aristotelian word, anagnoesis.
Well, the translation in
Okay.
English is just acknowledgement. So I guess it's
Okay.
a one of those technical terms that cannot be translated.
Absolutely.
It means kind of the moment when the character becomes aware.
So it's a change of state, which is usually suggested by the choir.
Yeah, when Oedipus suddenly realizes, oh my God,
again,
that's my father.
Relation, okay. So there is this parallel, which I think it's worthwhile mentioning. Complexity is a tragedy. It has no solution. And one must acknowledge that a change of state is needed. And this change of state, change of condition, happens in society with the choir.
Yeah. So a collective relation, so a tragedy has its complexity, no solution, but requires action and requires collective action.
It requires a change of state, a change of condition.
A change of state, which might not be, I want to know, I want to solve at any cost. It might mean I am coping. I am acknowledging and coping with the situation. And so my approach changes. Which doesn't mean accepting the situation, but it means like taking the situation and understanding that, switching a mode. Yeah, totally.
I wonder, could we apply that to change of state at a societal level as well as a system, as whether it's the health system or social welfare system or change of state? Because as I was hearing you describe this, I was thinking one of the downstream consequences of thinking about COVID-0 in the context of a virus that has reservoirs across animals, has mutation, has transmission when we are not symptomatic, and sort of this aspiration to get to COVID-0 and passive pathways to try to achieve that, versus, because that was the complexity that we were trying to solve, versus taking that moment of that change of state at a systems level. There was better, the workplace, all of these elements of active resources strategies. I'm just reflecting as you were saying that.
Yeah, and I mean, I think we've moved towards our public discourse. There's no longer goes towards COVID-0, but at the same time, how that then will move towards us really becoming socially wise and systemically wise, more attuned to different kinds of policies and the necessity to clamor for and modify policies, equitable policies, and so forth. That's I think the question that is still with us, and I think it might be with us for the next little while, because this is not the first and nor the last pandemic that we'll be dealing with.
Yeah, but I mean, like, this is like, how do we move from this to that if we don't have any change in between? And that's the big question. And then that's something that we need to solve, right? And like, we're not going to move there if we don't do all of these, go through all these steps. So yeah, I see that it's 7. It's almost 7. But so like I think you still have something to say. So like let's finish this after your remarks.
Oh, apologies. I just was thinking.
No, absolutely. Like, go ahead.
The danger of sort of thinking about normal as status quo, or thinking about better as status quo, or acceptance as status quo versus, I think, what Salvatore was describing is that state, that change of state. I thought that was beautiful.
Yeah, I agree. Yeah. Okay.
Thank you. Perfect ending.
Yeah, no, I think we are quickly moving towards our next session, which is going to be next week. So if you want to see next episode, tune in next week with 4 other very like brilliant speakers and roundtableists who I'm sure will take it to the next level. And I'm actually like I'm so happy that this discussion happened, and I am pretty sure that we will follow up next week. So like I hope that you will join us.
Thank you so much.
Well, you want to say something to conclude?
To me, I just wanted to thank you for a really engaging conversation, and for it's not very usual to have again scientists and artists on the same panel, and that was really what we, or official scientists and official artists on the same panel, and that was one of the goals of the speaker series, to start sort of to limb those boundaries and actually show how much of overlaps and there is. So thank you all so much, and thank you to Madhur also, who had to leave early. It's a wonderfully stimulating conversation tonight. Lots to think about, lots to stay with.
Absolutely. Clap.
Thank you so much.
Thank you very much
for listening. I hope that we enjoyed. I don't know, the people here in the chat, we enjoyed it a lot. So
there's a lot of people on YouTube who are following. Hi, okay. People on YouTube, you're very shy.
Hi, people on YouTube.
We see you.
We will see you. So,
okay.
Thank you so much.
And fantastic. So like, I'm looking forward to the next one. So see you, everybody.
Yeah. Bye. Thank you so much.
Yeah. Bye, everybody.
Bye,
and
bye.
Thanks so much to the moderator.
And 1 o'clock for us.
Buonanotte.
Yeah. Good night.
Exactly.
Bye, team.
Bye, everybody.
Bye. Grazie. Ciao.